The stories are amazing. I've collected stories every week I was there. So I have 12 weeks and pages of the way yoga had affected individual people's lives, not just for themselves, but for their families as well. And what we were looking at were people in our medication-assisted treatment program. That's who this program served. So these are people who had a dependency on opioids, who were also on buprenorphine. And somatic therapy is such an amazing therapeutic modality because it really touches the inner person, the inner soul, places where talk therapy just doesn't reach. And so it's always been my personal belief that when you integrate this kind of therapy into behavioral health, you can actually change people's lives on deeper levels and quicker than you could do with just traditional talk therapy, even though traditional talk therapy has an amazing place in our world and is really great for lots of people. And out of all the stories, I think the one that touched me most and really showed the power of somatic therapy and yoga as an intervention, and I'm just going to read it, was one of our participants said that, oh, there's so many. Let me get this one. This is the first time I have not felt like an addict. Drugs are what I did, not who I am. And I thought that was so important to really, we talked about going back to the true self and who that true self is. That one statement said it all to me, that we are not what we do. Who we are might have taken some wrong turns along the way, but it doesn't mean that our true self is not there and we can reconnect to it. And the beauty of yoga is that de-identification with things that aren't true and then finding out what is true. And that was so true for so many people.